Good evening, Dr. Devan sir. I am Dr. Srinivas Ramaka. Actually, I am a consultant cardiologist in Hanmakonda, Warangal, Telangana.
Oh my God.
To briefly introduce, actually, I know Mr. Paul from 2001 onwards.
Oh,
Basically, I am a consultant cardiologist, sir. I am in non-invasive cardiologist. Initially, for a few days, for a few months, I was a consultant in Hyderabad. But after that, after completion, I did my DM in cardiology from Manipal, KMC Manipal, under Dr.
DM
SGS,
cardiology.
DM cardiology
Anda
in
Prabhu.
under Dr.
Oh,
Prabhu.
Dr. Prabhu. Oh,
He was,
famous name.
yeah, he was my teacher, and that was
Oh,
in 95 to 98, sir. 98. After that, 98 to 99, for a few months I was in Hyderabad. Then I established my own center in Warangal, Telangana. Initially, basically, though I am trained in non-interventional cardiology, but I choose non-invasive cardiology as my main profession. So until 2015, I ran an ICC also, emergency care. 2015, right now I'm managing an outpatient care with ECG, echo, and treadmill test. That's all. And
oh, that's nice.
another thing, what I would like to say, apart from my private practice, I've been involved in my basic interest in community cardiology, like creating awareness in cardiology among these lay public. Actually, every year, as you know, World Heart Day is one event, World No Tobacco Day is one event.
Yeah.
So initially, from 99 to date, under this what you call a Know Your Heart program, creating awareness among cardiovascular disease in particular. 2009 onwards, I am concentrating more on what you call because cardiac arrest is an important thing which we encounter as cardiologists, and here from the
Yeah.
lay also on I am creating awareness on cardiac arrest and lay public. Lay rescue or CPR training for lay public. This is the one which I am concentrating more on now, actually.
Oh,
So, and that is one aspect of the community cardiology. And apart from the community cardiology programs, I'm also within my purview. I do some research also. Like I'm
uh,
interested in the epidemiology of cardiovascular disease and
uh,
case patients and tobacco prevention research. Then
oh,
some cardiovascular topics like atrial fibrillation, left bundle branch block, cardiovascular
uh,
disease in women, cardiovascular disease in the young, like less than
oh,
all these things which I've been concentrating. Now,
oh,
I'm doing one major, in 2020, we did one major project, so like anywhere in the world, this out of hospital cardiac arrest is a major public health problem. So when there
yeah,
are hospital cardiac arrest issues in elsewhere in US, UK, New Zealand, and other countries, Australia and other countries, they have what are called the registries. Like
uh,
registry on a particular disease are very less in our country, sir.
yeah,
So this out of hospital cardiac arrest registry, we did the first one in the country. The Warangal
oh,
out of hospital cardiac registry, that's the one thing. And
oh,
now, whatever whoever patients attend to my clinic from last 5 years,
yeah,
2020 to date, and there's an ongoing one. We are doing what's called the Warangal Heart Registry.
oh,
Are some of the activities which I'm doing right now. Basically, the cardiovascular research, basically clinical research,
yeah,
only observational studies, and apart
oh,
from CPR training for lay public and
yeah,
awareness on cardiovascular disease.
oh,
Improvement
nice.
the things which I'm limited.
Oh,
So I
so
heard a lot.
you might know Thomas, who's in charge of cardiac cath lab.
Cathla, I know Thomas. Well,
My classmate, my benchmate.
okay, okay.
We sat on the same bench in PUC, Trichur.
Oh, Thomas is still there?
Yeah, no, now he's retired. And the other day he had a small MI.
Okay, okay.
Yeah, his second MI. Earlier they put a stent in him, but about a month, 2 months back, he had an MI, rushed to the hospital. Now he's okay.
Okay.
We
Thomas, I
are
know.
very much. Oh,
To meet him, you please convey my regards to him.
super, super. My God. Every day he will send a message. We have our classmates group. Every day he will put a message, and once in a way we chat like that. And what happened?
I'll take his
What
number.
happened in? Yeah, definitely. I'll forward my number to his number to you. What happened about 4 months back on October 28th? I had a very bad stroke, a pontine infarct, and I
Okay.
was bedridden for 3 months. And left arm, left leg was paralyzed, face was paralyzed, voice was gone. And of course, Thomas came all the way from Manipal to see me. But I had a wonderful team look after me, and somehow with the Paul's and everybody's blessings, I have now my power is recovered. I walk with a little difficulty. My speech is a little still slurred a bit, but overall I'm okay. But that is
I
a lucky.
I heard that you are a very good ENT surgeon.
No, no, no. I am a very poor. Paul has a nice way of putting across things. But ENT wise, of course, 11 years I was professor and HOD of ENT of AJ Medical College. But in the administrative way, because the inspector will come somehow, in about 11 years now, we have got 5 PG seats. So which means I got 15 PGs in my department, a large department now. But recently I have stepped down as HOD and professor. I was vice dean also, and now I'm just a faculty in my department. But one incident that happened with Thomas in Manipal, once in a way I used to take my PGs to Manipal to show his cardiac cath lab and the various blocks where patients are primarily stored digital subtraction angiography for angiofibroman, esophageal. And then Thomas would show the various blocks of heart and all that. I made an inadvertent comment. I said, how sad all of them will have to undergo bypass when they can be reversed by a drug. So when I said that, my PG who was with me, he said, sir, please help me. My father's to undergo bypass in 1.5 months' time. They have quoted 6 lakhs in Calcutta, and all the money is not a thing, but still a major open heart bypass and all that. What is the drug? Can you please give it to me? After all, what is it? So I wrote tab this thing, 2 tablets 3 times a day. In about a month, he came and told me, I don't know what miracle you have done, sir, because when now pain, anxiety, everything disappeared. They did a repeat angio, no block at all. Now, what I gave was Maxibart,
Maxpert.
icosapent, yeah,
Enteronic acid. Okay, okay, sir.
icosapent, 2 tablets thrice a day, that is 6 tablets a day.
Okay.
And that is the time I was so much into the essential I mean, omega 3s
Okay.
dissolved in cholesterol and all that. 1 month later, it had completely disappeared. Now,
Yes,
that
sir.
is one thing. And the other thing was when my mentor, you must have heard about BMA, once in
Yes.
4 years, he organizes a cardiac event. So he had brought a lot of foreigners, and they were saying at that time, many, many years back, they were saying, we don't know so many cardiac problems, so many blocks, and so much of bypass. We don't know why it is so epidemic. And then when this keeping on saying, we don't know, I thought I should not keep quiet. So I lifted my hand and I stood up and said, may I make a comment? Even though I am not a cardiologist, I'm just an ENT, but may I make a comment? And they were wondering what is this guy going to talk about. And I said, when I was young, in my fourth standard, the in our house paddy field, red rice would be brought home. They used to be hand milled, and then we had forced to drink red rice ganji. That is a rich source of pyridoxine. Pyridoxine prevents the endothelial thickening, and
Yes.
pyridoxine deficiency is the one that causes the endothelial intimal thickening, and as a consequence, therefore, that is the reason too many heart blocks are there. And those who have been given B6, B1, B6, they have gradually reversed. And one lady, she in American County, she made all her patients take one B complex every day for 3 years. No heart attacks. Ultimately, she was terminated because from her area, no case for cardiac bypass. So that was
Okay.
amazing. But recently, I built on that work because I'm now so much obsessed about homocysteine. In
Yes,
when we
yes.
do a corporate checkup, homocysteine is something nobody does. And the other day, one fellow came. I run a Bangalore clinic. One fellow came, and I just said, "Shall we check the homocysteine?" We checked. It is around 200. It should not be more than 15. I said, "As you go out, you will have an attack and die." And then I gave him something. 1 month later, it has come down to 50. Now, recently, my wife's mother, she had an 80% block, and then my cousin, that is my father's sister's daughter's husband, he had a 90% block. Then he was taken to Devi Shetty, you might know, in Bangalore.
Yes, sir.
And Devi
Bangalore.
Shetty said, yeah. Dev Shetty is my 1 year senior, and he called me, and then he said, "Listen, the situation is quite bad. Better not take a risk. I can maximum, I can allow for 6 months. If they want to do, they can do it right now, or they can think about it. It's a 90% block, anti-descending and left circumflex. They can take it a call." So they came to me, and what I did was, because this is ever growing importance on the homocysteine and folic acid, so I put them on omega 3 and folic acid. And 1.5 both my wife's mother and this guy, irrespective, the wife's mother from Calicut, they went for a checkup. Absolutely, completely opened up. I put them on Fold White MB, Mega and Mega 3. Fold White MB and Mega 3 twice a day, morning and night. 2 months later, 90% block completely disappeared, completely opened up. What a magic it is. So I said, Paul, we have to utilize this. Number one, we have got to become rich. Number two, we have to give something back to society. So we mutually decided to start what is called a heart health program, 550 rupees a year. But if a person joins this program and follows what we say in writing, I absolutely guarantee 100% heart attack or heart blocks will not happen. But the question is sudden cardiac death. No, SAD, sudden cardiac death. My take is primarily the bundle of his undergoes like an electrical short circuit. It undergoes a short circuit. The only thing that can prevent that short circuit is again omega 3. Take one omega 3, 1 week it will protect. So take one omega 3, I give omega 3, 4 tablets a week, 4 tablets a month. Sudden cardiac death, we will do a proper checkup, everything will be normal. By the time they walk out of the hospital, they can have a sudden cardiac death and die. But take a omega 3 once a week, after all, they're taking 4 tablets a month. 100% a patient will not die. So my children's classmate fathers in their journey, 3 of them had a heart attack and passed away. What a tragedy it is if the breadwinner passed away. So I discussed with too many people. I wrote to WHO earlier, and I said, if you're part of the program, art-wise, you'll be healthy. But there is a major side effect that you'll face, because I've been running in this program not on a proper systematic official basis. But whoever who came to me, I used to give full vitamin B and omega 3. So far in the last 30 years, there has been not a single death, and now they are praying for death. People have reached now 80, 90, because 30 years back I took them on when they were 60, 65. They are all reaching 80, 90. Doctor, please let me go. I want to die. But can I stop medicine? Can I say stop taking? No, that's something I can't do. They are now begging for death because the heart will not stop. And the other thing I tell people, what is the America's best kept secret? America's best kept secret is either we can talk of streptokinase, urokinase, or tissue plasminogen activator. But in 1 minute of chest pain and profuse sweat, in the first 1 or 2 minutes, swallow an aspirin tablet, 99% of death will not happen. So everybody after 40 must carry an aspirin, 2 tablets of aspirin in their pocket. So in my program, I will ask them, you carry your aspirin, because by chance something happened, just swallow, you won't die. How many deaths happened? That famous film star Bangalore, I mean, if he was given an aspirin, he would have survived. He would have survived. Yeah, Puneet Rajkumar.
Puneet Rajkumar, yes, sir.
Yeah, he went to the cardiologist, they did something, but given aspirin, that should be in the pocket. If that is swallowed within 1 minute of a sudden of a heart, chest pain, and profuse sweating, all that, 99% they will not die. So anyhow, I hope we can have you as a guide mentor for this program, and I hope Paul will be able to take it forward. So these are my few takes. They gave me a clinic in Dubai, Align Medical Center in Ajman, Dubai, and the chairman said, "You're doing so much work." He gave the entire hospital to me. He said, "You take over the hospital, you run it." I said, "So many people in the Gulf are having heart problems. My prime requirement and focus is to start a heart health program." And when I was discussing, he said, "Nobody." I said, "I guarantee nobody will have a heart problem Immediately he said, stop, stop, stop. If nobody has a heart problem, how can you run my hospital?
Yes.
No, you don't make business sense for me. I don't want you. Thank you. I don't want you. So that then I stopped my Dubai clinic. But I'm happy. The way I'm happy. I'm now in a place called Ashburn in Ireland,
Ireland,
where
yes.
my children are. Yeah, so I came for a holiday here. 1 month we'll be here, and after that I'll be going back to Mangalore. And I hope, with your guidance and with Paul's marketing ability, we will be able to start this heart health program in a major way. My other focus is how many people are suffering from cancer. I've been minutely looking into the molecular basis of it, and now I have been looking into what is called the GK switch, from glucose to ketone switch. And when we
Yes.
switch the body's metabolic phase from glucogenesis to ketogenesis, when the body is in a ketone mode, a cancer cannot eat ketones. A cancer can only eat glucose. When the body is in a ketone phase, cancers will die. Of late, they have switched over into major keto dieting program, especially pioneered by this guy called Walter Longo and Sachin Panda, and they have terminal cancer cases which are getting completely cured. What a miracle it is! So of late, I said cancer patients who can't afford 20-25 lakhs of chemo radiotherapy and other things, I said, if you are willing to come on over, I will take you on and I will cure you. Because when the body is in a ketotic phase, the cancer cell cycle in 48 hours, the next cycle, they cannot breathe. They will suffocate, asphyxiate, and undergo apoptosis, and they will die. So this is
Yes.
a few things I'm doing, and I'm one so thankful to Paul for connecting me with you. So the various
Great.
fantastic, yeah.
So actually, the World Heart Day and No Tobacco Day every year I have been doing regularly, sir, to creating
Oh, so nice, so nice.
awareness.